just like the factors that we had to consider when choosing the appropriate disinfectant or antiseptic or a physical method of control, we also have factors that have to be considered in choosing the appropriate antimicrobial drug that we need to use to treat an infection. One of those things that we need to look at is, do we need something that is bacteriostatic, it's slowing down the growth, or do we need something that is bactericidal, meaning it's actually killing the bacteria, or fungus, or whatever the other microbe is? We have to look at the spectrum of activity. What type of microbes does it target? What is the dosage? How is it going to be administered? Is it going to be in a pill or liquid form? Does it have to be administered with a shot? So intramuscularly, can it be, does it only have to be given IV or intravenously? So we have to consider that. We have to consider the side effects. You know, what possible effects could come from giving a patient this medication. And then we also have to look at what are some interactions. We know that people take a lot of different types of medications. So is there a potential for a reaction between the two different medications? Now, we're going to talk about this almost like we're talking about just, you know, antibacterials, but keep in mind that this can be translated to any form of antimicrobial therapy, so fungi, protozoans, whatever. So first, do we want a static action or a cidal action? A bacteriostatic drug causes inhibition of growth. Bactericidal drugs actually kill the bacteria. So you have to determine, are we going to use a bacteriostatic or a bactericidal drug? And that depends on the patient themselves, what is their overall health, and it also depends on what type of infection are we dealing with here. If a patient is, you know, immunocompromised, you want to go with bactericidal because we need something that's going to kill those bacteria, because this particular patient's immune system may not be able to get a foothold on this infection if we just treat it with a bacteriostatic. You know, someone with a healthy immune system, if we can get an antibacterial agent that slows down the growth, that gives time for the immune system to get in there and take care of the rest of the infection. So it really depends on the health of the patient and then the type of infection. If we have something, you know, that is life-threatening, then we want to issue a bactericidal drug regardless of the health of the individual. So then we look at spectrum of action. This is what types of bacteria are going to be targeted. A narrow spectrum antimicrobial agent targets only a specific subset of pathogens. So, you know, this one could target gram-negative or gram-positive, or maybe this only affects the mycobacteria. So if we know the exact pathogen that is causing the infection, then we'd like to treat it with a narrow spectrum antimicrobial agent, because we want it to be as specific and target the specific pathogen, because we don't want to have any effects of it killing off, you know, the normal flora. Compare that with a broad spectrum antimicrobial. This targets a wide variety of pathogens, including, you know, gram-positives and gram-negatives. If we don't know what's causing the infection, what type of bacterium is causing the infection, then it's best to go with a broad spectrum, because then you can target a lot of different bacteria all at once. The problem, though, with that is that the broad spectrums can also damage or kill our normal microbiota. And this increases the risk of what we call a super infection. So this would be a secondary infection that could occur. If the antibacterial agent kills off some of the normal microbiota that have been keeping this other infection at bay, then when those microbiota are gone, this other bacterium can then start to replicate and cause an infection. And one of the best examples that we see of this is the infection with Clostridium difficile, commonly called C. diff. C. diff is often a normal member of the flora or microbiota within the intestines. And we have so many bacteria that live there that they don't let the Clostridium difficile, the C. diff, grow out of control. But if an individual is given a broad spectrum antibacterial agent and it starts to kill off those other bacteria that are in the intestines, now there's less competition for the C. diff and it can start to grow. And since it is not susceptible to that antibiotic, it can cause this super infection. Then we have to look at the dosage. With the dosage, we have to get to what we call the therapeutic drug level. And we need to get to that optimum level. We don't want it to be too much. We don't want it to be too little. And we have to consider the selective toxicity here. We don't want to have our dosage be so high that it's going to cause side effects and damage to the patient. No matter the work that's put into this and the research that's done, some people are going to experience allergies and some people are going to experience side effects to these drugs. Everybody reacts to them differently. So the goal is to select the optimum therapeutic dosage that minimizes the risk for side effects, but still accomplishes the overall goal, which is getting rid of the infection. We also have to consider the time interval between doses. We look at the half-life, which is the rate at which 50% of the drug is eliminated. How long does this drug stay in the bloodstream? Do we need to have a dose that's 3 times a day, 4 times a day, once every other day? What is the half-life of this drug? How many doses is it going to take? And how far apart do they need to be spaced? Then, of course, we have to consider how is the dose going to be administered. Drugs that are administered orally, they're preferred because you can go to the pharmacy, pick those up, and then take them at home. Sometimes, though, we have drugs that aren't readily absorbed from the gastrointestinal tract into the bloodstream. And so we may have to do, an intramuscular injection or an intravenous route of administration. Maybe it's topical. If the infection is topical, then it would be best to have some type of cream or ointment that you put directly on the skin. So we have to consider how the drug is going to be administered. And that also affects the dosage. You see here with, these are plasma concentrations of a drug over time versus, the oral route, the IV route, or the IM route. When a drug is administered intravenously, we get very high plasma concentrations of the drug very quickly, and then it slowly starts to decline. With intramuscularly or orally, it takes longer to get to reach that peak, and then we get the decline, and we're not getting as high of a concentration of the drug. And some of this depends on the seriousness of the infection as well, and what the pathogenic agent is. So we have to consider, drug interactions. That's one of the other factors we have to consider. We can get what we call synergistic combinations or antagonistic interactions. A synergistic combination is when we use 2 drugs because the 2 of them together are better than either drug alone. And the best example of this is with Bactrim or Septra, which is a combination of trimethoprim and sulfamethoxazole. If they are given individually, they're bacteriostatic. But if we combine them together, than they are bactericidal. If we look at antagonistic interactions, these can produce harmful effects. One of the best examples of this that's been well studied is the use of some antimicrobial agents and with someone simultaneously taking oral contraceptives or birth control pills. We know that there are certain antibacterials, especially if we look at penicillin and relatives of penicillin, that really decrease the effectiveness of birth control pills and can lead to accidental pregnancies because there is an antagonistic effect between those two medications. So we really have to consider all of these things when determining what is going to be the best form of action or the best course of action to be taken when we're given medicine to a patient.